A CNO's perspective on healthy work environments is our episode topic. Rejoining us for this episode is Dr. Jim Ballinghoff, Chief Nurse Executive at the University of Pennsylvania Health System. Jim is also the Vice President and Chief Nursing Officer at Penn Presbyterian Medical Center and Assistant Dean for Clinical Practice at the University of Pennsylvania School of Nursing. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Jim, welcome back. Can you remind us about yourself and your organization?
I am the Chief Nursing Officer at Penn Presbyterian Medical Center, which is a level 1 trauma center within our health system. Also the Chief Nursing Executive for the health system, the University of Pennsylvania Health System in Penn Medicine.
And can you talk a little bit about the work PPMC is being focused on in establishing and maintaining a healthy work environment?
Sure. I'm going to probably, I wear two different hats, sometimes when I'm at the entity and some when I'm at the system, but I'll approach this from the system and get a little bit more granular. We just completed a system-wide nursing strategic 5-year plan, and the framework or primary pillar is wellness and workforce investment. To operationalize that plan, we implemented a work group of nurses who are solely focused on generating ideas that'll help improve the work environment, addressing the physical and emotional well-being of our workforce, strategies that decrease burnout, and documentation burden. When we're at the entity level, we just completed our nursing satisfaction survey through the National Database of Nursing Quality Indicators. And typically what we do when we get that information back is that we ask through our shared governance structure that each one of our units develop an action plan on an area of opportunity for their particular unit. I asked this time around that no matter where your areas of opportunity were, to focus specifically on job enjoyment, which would incorporate wellness into that. We did outperform all national benchmarks through the National Database of Nursing Quality Indicators. So we did fairly well in light of all that's going on in our profession and in our industry. But the joy that I experienced when I was at the bedside is not necessarily there now. And that is because wellness is compromised in our profession. And so I have at the entity level, us focusing on just specifically job enjoyment and wellness. And then it's a major pillar for us at the system level.
That's excellent. AONL endorsed the Nursing Organization Alliance's 9 elements of a healthy practice environment. And I was wondering if we might use those elements as a mean to frame our conversation and discuss how they are used or implemented. We can look at it either at PPMC or even at the broader organization or a combination of both. Can you talk a little bit about your collaborative practice culture?
Sure. I'm going to do a combination of both here. Partnerships and collaborating are very important to us at Penn Medicine. It's always been part of our structure. And we value our partnerships within our departments, within our entities, but across entities as well, and with other disciplines. And I would say that most of our structures and our initiatives are interdisciplinary because we want to foster that collaboration. We also have established a selected set of norms as part of our journey to high reliability. And they include mutual respect and respectful communication, which includes active listening, being inclusive of diverse thinking, and that we can speak up and speak out when those behaviors aren't supported.
What does a communication-rich culture mean for you at PPMC?
Yeah, it means that we're transparent, for one. It means that we embrace bi-directional communication, that we're actively listening. It means communicating frequently and in several different modes. People hear differently or will go to different sources. An example of that would be we communicate in our huddles, but we'll also communicate. We have a newsletter called The Five Things That You Need to Know, and that goes out every single day and we'll reinforce information there. We have information sharing meetings where meetings are just set up to share this information. They're not necessarily working meetings. We have open forums. We will duplicate things in emails and on our website so that if you didn't hear it in one setting, you'll hear it in another. That bi-directional would not only be through informal channels like rounding. I love to be out there rounding, talking with the staff, hearing about their experience, what they need, things like that. But we also have a formal process through our shared governance structure.
I was going to ask you what transparent means to you, but you almost already answered that question of all the different modalities and ways that you are out there trying to communicate. Also, with different learning styles and different listening styles that
So,
people have, sounds like you're hitting it all across the board.
yeah, that's always been part of my leadership style, particularly around transparency. I think if you give people the information, even particularly around difficult decisions and how that decision got made, you will get support around you, or at least an understanding by sharing that, information. So it's always been part of my leadership style.
So as we talk about transparency and go a little bit step further, when we're talking about role expectations, how do we ensure that those are clearly defined and that everyone is accountable at PPMC?
That would be a multifaceted approach. I think first, we make sure that it's in the job description and that people get that job description when they're hired, they sign off on it, that they have an understanding of that. We educate in orientation on our core values. We have competencies that focus not only on knowledge and skills, but also on attitude and accountability. We also reinforce this in our evaluation processes. We're here on a journey towards high reliability, which emphasizes accountability.
Now, in the midst of a large workforce shortage, the fourth element is likely a challenge for many. But what are you doing to have the presence of an adequate number of qualified nurses on your team and in your organization?
As a leader, I have two top priorities. One is to our patients and ensuring that they receive safe, quality care. And the other is to create an environment where nurses want to work and can safely and effectively provide that quality care. Nurses want to work where they have safe staffing ratios. And whether or not you support government mandated ratios or not, we have to ensure that nurses feel like they have adequate and safe staffing. And that means different things for different areas. But ultimately, you can't have nurses running from the beginning of their shifts to the end of their shift every single day and then claim that we have adequate staffing. You really have to listen to the nurses and advocate for the resources that they need.
You used an interesting word there, advocate. So, what does it mean for you to serve as an advocate for nursing practice more globally within the organization? You are the representative of nursing practice in the C-suite and at all of those higher level meetings.
Yeah, it means ensuring that nurses have adequate resources to provide safe, effective patient care. So that's not only staffing, but the supplies that they need and that they're there when they need them. It means that we build upon their education to ensure that they have the skills and knowledge to be able to be proactive and reactive for all patient scenarios that they might encounter. It means that we provide resources and opportunities for continued professional development, advanced education, and certification support. It means evaluating competencies on an ongoing basis. And it means that we are true collaborators and partners with other disciplines that influence nursing practice.
How are the expectations regarding the presence of expert, competent, credible, and visible leadership put into practice at PPMC?
Yeah, we have the same expectations for our leadership teams as we do for our frontline staff. We have educational requirements for specific positions. We evaluate competency on the appropriate leadership, knowledge, skills, and attitudes. We provide ongoing opportunities for professional development, and we expect that our leaders are authentic and that they walk the talk and demonstrate the behaviors that we expect from others.
What does shared decision making look like as it relates to both healthy work environments and how that operates within the organization at PPMC?
Yeah, all of our critical care units have implemented the AACN Healthy Work Environment Standards, and we essentially stole those standards for other areas, and that includes true collaboration and effective decision making. We utilize our shared governance structure to facilitate that decision making process to ensure that the staff on the front lines are included in decision making. We have had a very robust shared governance structure for many years here at Presbyterian, and it's produced many great leaders over the years. Many of our chairs from our shared governance unity councils have gone on to become managers and even higher than that to director levels at some point. And most of what we work on in that structure is either clinical practice or healthy work environment enhancements.
You answered my next question a little bit already, but we'll see if maybe there's anything you want to add to it. I was going to ask what professional practice and continued growth and development looks like at PPMC, but what I'm hearing is you've got a mechanism in place where people are getting involved in shared decision making at the staff level. And because they're so engaged in it, you've got an opportunity to bring them in as leaders and managers and grow and continue to grow them within your organization. That's almost something that was happening decades ago, but is non-existent almost in a lot of other organizations right now. What do you think the secret is to that success in your organization where others may have had more of a turnover in that area?
I think it's around making sure through these structures that you're not just focused on the outcome of the committee work, but you focus equally on the people who are doing the work and their development and making sure that they're getting the opportunities to take on uh, extensions in their role or and take on projects that can hone in on the skills that they're really good at and highlight those skills, and which in turn helps them feel valued and brings more engagement to the process. And through that, inspires them to want to go on and take on a higher level leadership positions.
How are nurses recognized at PPMC for their meaningful contributions to practice?
Sure, that's multifaceted as well. We have a lot of different opportunities here. We have a leveling system here. You can, as you take on more responsibility, you can apply to go up to another level. We on the side, we recognize years of service and we make sure that we recognize nurses for that and their years of experience. But they also have another opportunity to move up. We have 4 levels within the nursing department that they can move up in and take on additional responsibility there. We also have a distinguished nurse clinician academy where we recognize several nurses every year who are at the front line, on the front lines at the bedside, who want to stay at the bedside and don't necessarily want to move into leadership roles, but they bring a great value to our patients, to our organization, and we want to make sure that they're recognized and that they're happy. And we give them a stipend if they want to either use on themselves or they can use it for a project of something they want to highlight. We also highlight any contributions that people make in our newsletters. We recognize their achievements. We will call that out in huddles, in our newsletters. We put it on our websites. We have Nursing Excellence Awards every year to recognize nurses who've done extraordinary work. And then we also recognize people through our committee structures.
Wow, that sounds like a lot of recognition, but it's so important for people to feel and hear the value of the work that they're doing and know that they're making a difference.
It's critical.
Any closing thoughts as we wrap up this episode about healthy work environments?
I think these are really challenging times for us in our profession and in our industry. And that can feel very daunting at times, but it's not the first time that we've had challenges like this. There's some unique challenges that we're experiencing, particularly with violence and aggression, but we will navigate these challenges and we're going to come out a bit stronger and better. And even though it might not always feel like that, we're going to survive this and we're going to be much stronger for it.
The staff's value of being heard, being seen, and being recognized. That is so important in establishing and maintaining a healthy work environment. And you've hit on that today in this episode. Jim, thank you so much for discussing all things advancing a healthy work environment in nursing practice. I greatly appreciate your time.
Thank you for having me.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.